Hi everyone, today we have a special guest. He's Kevin Lomangino, the managing editor of HealthNewsReview.org. He is also an independent healthcare journalist who was previously editor-in-chief of Clinical Nutrition Insight, a monthly evidence-based newsletter for physicians and dietitians. He has written for numerous professional and consumer health publications, including Consumer Reports on Health. He was formerly senior editor at Lippincott Williams Wilkins, a medical publishing company where he developed new print and online publications for healthcare professionals and managed a portfolio of medical publications and newsletters. So, how are you doing, Mr. Lomangino?
I'm doing great. It's wonderful to be with you today, Ricardo.
Yeah, thanks. It's the same for me. So, to start off with HealthNewsReview.org, could you tell us a little bit of your history? How this idea came about to start this project and to start reviewing health news and so on?
Okay, so the reason we started reviewing health news is we made the observation, and certainly we were not the only ones to make this observation, but generally we found that the quality of healthcare news stories is often not very good. You see a lot of sensationalism. You see a lot of news stories that exaggerate the benefits of healthcare interventions, tests and treatments. They make tests and treatments sound very new and exciting and wonderful. They're going to be curing people, their breakthroughs. We're going to be curing cancer, Alzheimer's disease, all these different things. But when you actually look and see what evidence that's based on, it's often not very good evidence. They may make let's say a study that's done in mice sound like it's going to be applicable to humans, next week. And another issue with news stories is they often don't talk about the downsides of healthcare interventions, the harms that drugs can cause, that surgical procedures can cause. They often don't discuss those things. They often don't discuss what things cost, which is particularly an issue in the United States, where our healthcare system and our insurance system is not ideal, let's say, and people end up paying a lot for healthcare out of their own pocket. So there's a lot of problems out there with healthcare stories. Certainly, there are people who are doing really good journalism. There are news outlets that care. There are journalists who care and who are doing a great job. But if you look over the entire landscape of what's out there, most of it is not very good or could be improved greatly. And that's kind of where our idea for reviewing news stories came from.
Right. So at Health News Review, you apply 10 different review criteria to the journalistic pieces on health. Why did you choose these criteria and what are they based on?
So these are things that we think every consumer or patient needs to understand when they are presented with a healthcare news story about a new test or treatment. These are sort of basic pieces of information that are really important if you're going to make a decision about whether I want to take this test, or do I want to take this drug, or do I want to have this surgical procedure. There are certain things that you need to understand. And it's not just we who came up with these things. They've been written about in the medical literature by experts who talk about what patients really need to know. And so these are 10 things that we think can sort of serve as a checklist for journalists when they are writing a news story about a new drug or a new treatment. Just look at your handy-dandy list of things that we've conveniently put on our website, and you will be able to give your reader a pretty good overview of what they need to know about this test or treatment before they actually decide and have to make a decision about it. So do you want to go over what some of these criteria are, or how do you want to work it, Ricardo?
Yeah, I would like to go over all of them if possible.
Yeah, sure. Okay, well, let's start. I've got a list here. Actually, I've got a card that I carry around in my wallet that has the 10 different criteria. And when I'm on the road, let's say at a conference with journalists, I can just hand these out so that they always have a reference for what the 10 criteria are. Okay, so we start out, number one is what does it cost? Yes. That's particularly important in the United States, I think, where we don't have a nationalized healthcare system. And we sort of have a patchwork system of insurance where people often have to pay a lot out of pocket for healthcare. And so cost becomes a pretty big issue, especially when we're talking about new drugs or really high-tech, expensive new treatments that are often made to sound great in news stories. This is the best thing that's come along in the past 20 years, and it's going to cure all these diseases. But what does that cost? And can I afford it? It's not going to be a miracle for me if I can't afford the cost of the drug. So it's really important for news stories to give people a sense of what this is going to cost. And even beyond the U.S., even in places where there is nationalized health care, your healthcare system is going to be paying for whatever treatments are out there, and especially with some of these expensive new pharmaceuticals, there are important decisions to be made about whether the cost of this new treatment is really worth the benefit that it's going to give. So that's where we start. Then we move on to number two, which is what are the benefits, and are those benefits quantified? And that's important because a lot of times we'll see that news stories tend to exaggerate. They're a bit sensational. They talk about things being a breakthrough or a miracle, but what does that really mean for the average patient? And we need numbers. We need to understand from a numerical standpoint, well, how big was the benefit? Sometimes news stories will talk about something being significantly better than the old treatment. Well, does that mean significant? Significant can mean a lot of different things. It can mean statistically significant in a research article, but for the person reading the article, when they hear significant, they probably think that it means, well, it's going to have a really big noticeable effect for me. But that may not be what the study found, because a statistically significant benefit can actually be really tiny. And so it's important to really give a sense of how big was that benefit, and let's put some numbers to it. Sure. So number three is the potential harms of the treatment. A lot of times we'll see that news stories are very one-sided. All they talk about are how great things are. They don't talk about what the risks are. And when you're deciding whether or not you're going to try this new treatment, you have to weigh both things. You can't just think about the benefits. You have to understand that there's could be a risk that something bad will happen to you. And news stories need to take that into account. Number four is, does the story evaluate the quality of the evidence? What kind of study was this? Was it a mouse study? Was it a study of cells in a petri dish? Those kinds of evidence are not very strong, but often we'll see headlines that declare some great new treatment based on something that was done in mice. We often say that mice have been cured of Alzheimer's disease hundreds of times, but we've never cured human Alzheimer's disease. So when you see a news story that's based on a treatment given to mice, you should be very skeptical that that's actually going to translate to something that's beneficial for humans. And so the news story should really give you a sense of how strong the study was.
Yeah, and just for people who don't know about this to understand a bit better, when we're developing a new drug, it goes through several clinical phases, right? We have first preclinical trials in, like you said, a petri dish, for example, or even with other animal models, and then we have with voluntary people, and then we put it on the market and we follow the effects it has on the population, right?
Absolutely, and that process can take decades. It can take 10 years or more, and so we'll often see news stories that talk about that first step, preclinical models or animal studies, and they make it sound like, you know, next week you'll see this on the store, on the pharmacy shelf in your local drugstore. But in reality, it's going to take 10 years probably for anything to come from it. And in all likelihood, probably nothing will come from it, because 90% or more of the drugs that get tested in animals never make it to, you know, human testing.
Okay.
Yeah.
And so now number 5, does the story commit disease mongering?
Yeah, so disease mongering is a little bit tough to explain, and it's a bit subtle, but often what we'll see is, in an attempt to expand the market for a treatment or a drug, a company or sometimes a news story will go along with this. They will present the drug as if it applies to many more people than is actually the case. And we see this in areas like diabetes, type 2 diabetes. Now we have what's called pre-diabetes, which used to be just something that was a risk factor, but now we've actually called it its own disease. It's called pre-diabetes. And news stories write about it as if it's a disease. But in fact, it's not a disease. It's not going to cause you any harm. And many people with pre-diabetes are never going to go on to develop diabetes. And yet, I'm sure the drug companies that sell diabetes medications are very interested in making sure that people are aware that they're at risk, because those are potentially future customers for their drugs. So that's one way that disease mongering happens. Another way is when news stories present something that's not really a medical condition or something that's going to bother you very much as you know, some horrible disease. You know, when we hear about people who are suffering from baldness, let's say, you know, male pattern baldness. Are you really suffering from that? Is that really, you know, let's not talk about nail fungus as if it's this horrible disease that requires immediate treatment, right? So that's another way that can happen. And then related to that, we can move on to number 6, which is, does the story use independent sources and identify conflicts of interest? And what that gets at is often there's a commercial interest behind a news story. There'll be a company that sponsored the study that eventually is going to be covered by the news. And maybe the people who conducted the study are employees of the company, or maybe they're being paid consulting fees by the company, or maybe they're being paid by a competitor of the company that funded the study. So there are often commercial interests behind all of this that never get explained to the person who's reading the story. So when you see Dr. So-and-so, who's a researcher in new neurological drugs, let's say, and he does a study about Parkinson's, this new Parkinson's drug that's wonderful and great, you need to know that this doctor potentially, if he's received, let's say, hundreds of thousands of dollars from the company that makes the drug, well, he has an incentive to be very enthusiastic about that drug because he's getting paid by the company. But often those kinds of relationships are not disclosed in news stories, and that's something that readers really need to know. They need to know, where is this information coming from, and is it potentially tainted by commercial interests?
Yeah, and we also have to be careful with that analysis, because there are many people who call, let's say, the industrial complex, the pharmaceutical industry, big pharma, and then say that just because a study was funded by someone or some entity, some capitalist entity, like they say many times, that the study is not well designed, right? And that's not true.
Exactly. I think when we see something that's funded by the industry, I think we should be prepared to look very critically on the study and examine the methods and make sure that it's not being spun to sound better than it is. But you also have to look at the science based on its merits. And oftentimes, an industry-funded study of a drug, it could be the highest quality of evidence that you're going to see, and we should trust that. A lot of people will use the fact that it's industry funded to totally, dismiss any of that evidence and just say that it's all contaminated by big pharma. And that's not an answer either. We're not calling for people to be nihilistic. We're just calling for people to be, to be smart and to be a little bit skeptical and to critically evaluate the information that they're being presented with.
Mm-hmm. Exactly.
Yeah.
So, and the number 7 is, does the story compare the new approach with existing alternatives?
Right. So a lot of what we see in the news is about new things. Obviously, it's the news, right? So you would expect that you're going to see new things. So we have new drugs, new surgical procedures, and that's great. That's how medicine advances, and that's how we get better treatments. However, everything that's new is not necessarily better, okay? New things may cost more, and the new cost may not justify the benefits. New things may cause harms that the old treatment did not cause, and it may take a long time for us to actually figure out what those harms are. So just because something appears to be great, sometimes it takes a while to figure out that this is actually causing adverse effects. So we need to be a little bit careful. And we also need to just understand that there are often either commercial interests or people who are excited about a new therapy because they want it to work. They're hopeful. They want to develop new treatments that are going to be better. And so they may be overly enthusiastic about something compared to what the existing treatment was. So we always want to see, are the two things being compared in a fair way? And that's important for people to know about.
Mm-hmm. And then number 8 is, does the story establish the availability of the treatment /test /product /procedure?
Yes. So that can affect things in a couple of ways. One way is, as we discussed, there are phases to testing of a new drug or device or procedure. And if this drug is only in the very first phases of that testing, it's going to be a long time before it's actually available to the public. So a news story should help make that clear. Another way that this can affect things is via cost. Okay, if a new drug costs a lot of money and it's not covered by your insurance, it may be great, but if you can't afford it, it's not available to you. And then the last way that can affect things is, where is this treatment offered? Is it something that's only available at the most advanced academic medical centers? If that's the case, and you live in a rural area that's very far away from one of those kinds of centers, you're going to have a hard time accessing that therapy, and that therapy may not really be available to you. So that's something people need to know.
Okay. And before the last one, number 9, does the story establish the true novelty of the approach?
Yes. So again, there's an incentive in journalism and news to make things sound new, because new is exciting. People want to read about new things, but oftentimes we find that what sounds new actually isn't quite as new as it's being made to sound, because maybe another research team has already extensively looked into this, or years ago, the groundwork for this development was already paved with research. And that's important for people to know about, because it's only by sort of looking into the past, right? Those who can't remember the past are doomed to repeat it, right? That's true in world affairs, and it's also true in medicine. If an approach has already been tried and maybe was found not to be that great, well, we should take a lesson from that and understand what that means for us today. And if news stories don't acknowledge that history, people are missing the context that they need.
Exactly. And so then the last one, the last criterion, number 10, does the story appear to rely solely or largely on the news release?
Yeah, so one thing that people, the general public, might not be aware of is a lot of their news in either online or in the newspaper is generated by a news release. So this is often, it could be a company, it could be a university, it could be some kind of academic medical center that conducted a study, and they want to publicize it. They want to get the word out, they want to get news coverage. And so a lot of journalists rely on those statements as the basis for their stories. Now that's okay, except what often happens is journalists who are pressed for time will take shortcuts and just sort of rehash or regurgitate what they've already been provided in this news release. And the problem with that is whoever's issuing this news release has an incentive to make the news as favorable as possible for their institution. Okay, they want to make it sound really exciting and really good, and it's all about how wonderful this new study is and this new treatment might be, and they don't have an incentive to talk about the risks or the costs or the other side of the story. And that's what a journalist is supposed to do. But if all they're doing is taking a news release and rewriting it, or in some cases just copying and pasting it, they're not giving their readers the full story. And so that's part of what we try to assess with that criterion.
Okay, so as far as I understood it, your work is directed primarily at consumers and journalists to try to help them a bit. But it can also be useful to health professionals, right?
Absolutely. I think if health professionals looked at our criteria, that those are often the things that their patients need to know. So it can be helpful for them when I'll often hear from health professionals who have patients come into the office and they say, "Oh, doc, I saw this news story about this great drug, and should I take it?" Well, they can direct the patient to our site and say, "Well, here's a list of things that you should think about when you're looking at a new treatment, and how well does it stack up?"
Okay, right. So, and from these 10 criteria that we evaluated here, what do you think are the ones that are neglected the most?
Actually, I'm going to pull up, I can give you some statistics on this. We did a report at the end of 2017 quantifying the ratings, and so the worst scores that we see are on the cost criterion. Does the story address cost? 69% of stories that we reviewed were rated not satisfactory on that one. The next one was, does the story adequately quantify the benefits? 66% of stories were rated not satisfactory. So again, 2/3 of stories not satisfactory. Addressing harms, 63% were not satisfactory. Does the story evaluate the quality of the evidence? 61% not satisfactory. And does the story discuss alternative options? 54% not satisfactory. So from roughly half to more than 2/3 on those 5 criterion, which are the most important, I would say, we're seeing scores that are not very good. Those are stories that exaggerated the benefits, they downplayed the harms, they didn't talk about the costs, and they didn't really do a good job discussing the evidence that the study is based on, or the story is based on.
That's interesting. That's interesting. So, and why do you think these problems occur in scientific journalism? Do you think that it's because journalists are a lot under pressure nowadays, or maybe because scientists now and then don't inform journalists correctly, or any other cause?
Yeah, I think you've hit on a couple of them. Certainly, there are fewer well-trained journalists, healthcare, medical science journalists today than there were in the past. There's increasing pressure to put out more stories in less time than there was in the past, and that leads to cutting corners. I think there's more pressure on scientists and academics to maybe overstate the significance of their research, because there's a very strong incentive to do that, so that scientists can attract more funding and continue to do their research. And that's not a good system, because if the scientists are exaggerating what's going on, oftentimes the journalists who, as I mentioned, are under more pressure and are not as well trained as they used to be, they don't have the background and the knowledge to be able to push back against those messages that they're hearing from scientists, which, if they're exaggerated, are going to be making it into news stories that reach the public.
Right. And I mean, now that we talked about this, apart from doing work like you do at HealthNewsReview, covering these frequent mistakes, would you say that other solutions to this issue of bad coverage of health news and so on would be to tackle these problems that have been happening in journalism and in science and so on?
Yeah, I mean, there's a lot of different ways we can look at it. We're trying to provide help to journalists, giving them, some of the tools that they need to report on this more effectively. I think the leadership of journalism organizations needs to understand that putting out schlocky, poor quality journalism in the long run is damaging their brands. It's damaging consumers' trust in journalism, and eventually is going to lead to less readership for journalists and for news outlets. Even though in the short term it may seem like a win, you know, if you have a sensational headline that gets a lot of clicks, that's a good incentive to keep doing those kinds of stories. But over the long run, it's going to be damaging, and we're trying to help the leadership of journalism organizations to understand that. There's so many different aspects to this. It really, you could look at this, the way that science is funded and the incentives that scientists have to exaggerate the significance of their findings. If that system were changed, I think that would take out a lot of the incentive to make research sound more interesting or significant than it is. And another aspect of this that we didn't really touch on, but which is important, is public relations at scientific institutions, and well, really from many different kinds of institutions. It could be drug companies, foundations. Everybody wants to make whatever news they're putting out there sound really interesting. And a lot of times what will happen now is that news that they've put out there in a news release just gets copied and pasted and put all over the internet without any vetting, without any journalistic scrutiny. And if we could encourage those institutions and those public relations people to be more responsible, to actually use the criteria that we advocate for journalists in their public relations materials, I think that would also have a very big effect on the information that eventually reaches journalists and the information that eventually reaches the consumer. And we're trying to help with that by not only reviewing news stories, but in the last couple of years we started reviewing press releases and applying the same 10 criteria to those press releases to help public relations people improve the messages that they're putting out there. So it's a big chain, and we think improvements can be made at all different on all the different links that are in that chain.
Mm-hmm. Okay, so just before we finish, would you like to tell us a bit more about the work you've been doing at Health News Review, if you have something new coming about or not that we didn't cover here?
Well, a lot of the work that we've been doing recently is shining a light on conflicts of interest in healthcare and also healthcare journalism. And one of the things that people may not be aware of, and even a lot of journalists are not aware of, and some people don't think it's a problem, is with sort of the decline of traditional news outlets and traditional journalism, with the lack of funding, lack of subscriptions, lack of advertising, journalism organizations are forced to look to new sources of funding to make ends meet and to basically keep the lights on, right? And increasingly, those sources of funding are places like the pharmaceutical industry, or in some cases, we've seen the alcohol industry funding journalism training, funding journalism, funding actual journalism, funding what you might call advertorials or sponsored content. These are things that look like journalism to the unsophisticated reader. They may think it's news, but it's really a form of public relations or advertising. And we think that's troubling because it's one of the most fundamental aspects of journalism is that people have to trust it. They have to think that the people who are writing, have their best interest at heart, that they're not corrupted, that they're honestly and objectively trying to report the news. And once a seed of doubt is introduced there, you really have big questions raised about whether the reader can trust what they're reading in the news. And so this is a concerning trend. I don't know that we have any answers for it. We're fortunate to be able to have funding from a foundation, a philanthropic organization that pays for the work that we do, and we really have no concerns about where the money's coming from or whether there's some agenda that we're supposed to serve. All we do is report the news objectively and try to give people the tools that they need to do a better job. But elsewhere in journalism, that's not the case, and it's a problem that's on the horizon that I think is only going to get worse.
Mm-hmm. Okay, great. So I think it has been a great conversation. I hope it all goes well for all of you at Health News Review, because I really think that you're doing very valuable work there. And it was really a pleasure to have you on today.
Well, thank you so much, Ricardo, for having me on the program. I haven't seen much of it, but I'm certainly intrigued now to see more of what you've done. And I appreciate you giving us a platform to inform readers about what we do.
Yeah, of course, every time I want to promote science, so... Yeah.
That's terrific. All right.
Okay, so take care.
Okay. Take care, Ricardo. Bye-bye.
Bye-bye. If you appreciate my work, please consider supporting me on Patreon at patreon.com/thedissenter. Thank you.